In cannabis lore, it is a commonly held belief that the therapeutic effects of isolated CBD are different from the therapeutic effects of whole plant or full spectrum CBD. That is, an extract with CBD as the predominant constituent. This is supported by the notion of an entourage effect, which basically means that the other compounds in the whole plant extract somehow modulate the effects of CBD and lead to a clinically superior outcome. Outside of cannabis, this concept is known as botanical synergy. In reality, there is surprisingly little science that substantiates this belief about CBD extracts. In this video, we are going to examine a preclinical study designed to investigate differences between isolated CBD and a whole plant extract in an animal model of acute pain and inflammation. We're going to be focusing on 3 clinical questions. First, does oral administration of CBD reduce pain and inflammation? Second, does CBD in a whole plant extract have greater therapeutic efficacy than isolated CBD? And third, is a lower dose of CBD in a whole plant extract comparable to a higher dose of an isolate? In other words, does the potential for synergy among the various constituents in a full spectrum extract allow for the use of a lower dose of CBD in the treatment of acute pain and inflammation? This study was published in the journal Pharmacology and Pharmacy in 2015. It is a randomized controlled preclinical trial conducted in mice with experimentally induced localized inflammation. These mice were given isolated CBD or CBD in a whole plant extract, both intraperitoneally and orally, and then assessed for various pain and inflammation-related outcomes. As I mentioned, this was a randomized controlled trial, a preclinical trial, in young female mice with experimentally induced inflammation. The investigators injected an irritant called zymosan into the right hind paw of the mice. They administered the CBD via both intraperitoneal injection and oral injection in different experiments, and then tracked the outcomes at 2, 6, and 24 hours following injection. There were a variety of different doses of CBD used. The isolated CBD was dosed at 10, 25, 50, and 100 milligrams per kilogram. The whole plant extract was dosed at 10, 25, 50, 100, and 150 milligrams per kilogram of the entire extract, not just CBD. Tramadol and aspirin were used as comparative therapies. The outcomes were swelling of the right hind paw as measured by thickness, serum TNF-Alpha levels, which is an inflammatory cytokine, and the von Frey paw withdrawal test, which was used as a proxy for anti-nociception or analgesia. In the von Frey paw withdrawal test, investigators use a monofilament to poke the paw of the mice. The force of the poke is correlated with the gauge of the monofilament, and the higher the gauge that's required to induce a paw withdrawal, the greater the analgesia or the anti-nociception according to this test. I want to quickly point out Table 1 from the study. This is an analysis via gas chromatography and mass spectrometry showing the constituents of the whole plant extract. Notice that the extract contains almost 18% CBD and roughly 1% THC. This would be referred to as an 18-to-1 ratio. The conclusions drawn in this paper are largely about the effects of CBD, but we should remember that when you're giving 25 or even 10 milligrams per kilogram to an animal or to a human being, if 1% is THC, there's probably enough THC in there to have its own effect or perhaps contribute to the CBD effect. And so to draw a cause and effect relationship between one constituent in a whole plant extract and a set of certain outcomes can be very difficult when there are multiple active constituents. Now we're going to look at the results of this study. Starting with Figure 3, These are the graphs that show results of the oral administration. In graphs A and B, we are looking at a comparison of isolated CBD on the left and the whole plant extract on the right. On the vertical axis of each graph, we have the paw swelling measured by calibrated calipers as thickness in millimeter intervals. On the horizontal axis, we have the dose of CBD in milligrams per kilogram, going from 10 to 100 with the isolate, and then from 10 to 150 on the right with the whole plant extract. I've covered the milligram per kilogram dosing of the extract on the horizontal axis on the right with the milligram per kilogram dose of CBD in green and THC in orange below. Recall that the extract is 18% roughly CBD and 1% roughly THC. So this is how we can compare the dose of CBD in the extract with the dose of CBD in the isolate form. The control mice received the inflammatory injection, but they didn't receive CBD in any form. So first, if we compare the controls with the mice treated with isolated CBD on the left, we see that the swelling is not reduced until around 25 milligrams per kilogram was administered. Next, if we compare the 10, 25, 50, and 100 milligram per kilogram doses of isolated CBD, we can see that the 25 milligram per kilogram dose has the greatest effect, certainly at 24 hours. When a medium dose has a greater effect than a low or a high dose, the dose response curve is often described as a bell-shaped curve. In fact, this study is entitled Overcoming the Bell-Shaped Dose Response Curve of Cannabidiol by Using a Cannabis Extract. If we look at the dose response curve for the whole plant extract on the right, we see that there is a decreasing trend in thickness up to 9 milligrams per kilogram at 24 hours. This is more of a linear dose response curve up to the 9 milligram per kilogram mark. We see the dosages above that don't seem to offer any incremental benefit. So in summary, paw swelling seems to be reduced by both isolated CBD and CBD in the extract. At 24 hours, 9 milligrams per kilogram of CBD in the extract was comparable with 25 milligrams per kilogram of CBD in an isolated form. Now we are going to look at the anti-nociceptive outcome. We are still looking at figure 3. Here we have the paw withdrawal threshold on the vertical axis. This is, roughly speaking, the force required to induce a withdrawal of the inflamed paw when a monofilament is used to poke it. On the left, with isolated CBD, we see that there isn't much change at 10 milligrams per kilogram. Significantly higher force is required with higher doses, especially at 6 hours. And this tells us something about the onset and the duration of the effect. 6 hours seems to be a better time point for measuring anti-nociception, whereas 24 hours seems to be the better time point for measuring swelling. Both isolated CBD and the whole plant extract increase the paw withdrawal threshold, so that's good. The 25 milligrams per kilogram dose at 6 hours on the left appears to be more effective than the higher or lower doses. Again, this isn't linear, it's more bell-shaped, but the bell is distorted quite a bit here. On the right, with the whole plant extract, we see a small change at 1.8 milligrams per kilogram and greater efficacy at increasing dosages. And the curve looks relatively linear in an upward direction, especially at 6 hours. With a whole plant extract, it appears that a higher dose leads to greater anti-nociception, especially at 6 hours. So at 6 hours, approximately 18 milligrams of CBD in the extract is comparable to 25 milligrams per kilogram of isolated CBD. Looked at differently, the 27 milligram per kilogram dose of CBD in the extract led to greater anti-nociception than 25 milligrams of the CBD isolate. Now we are looking at figure 4 and the impact of CBD on serum TNF-alpha concentrations. Here we see that TNF-alpha concentrations are measured in picograms per milliliter on the vertical axis, and again, the various dosages of CBD are on the horizontal axis. On the left, with isolated CBD, we see that the lowest concentration of TNF-alpha is associated with the 25 milligram per kilogram dose, and that higher dosages are not associated with lower concentrations. Again, this looks like a bell-shaped curve. On the right, with the whole plant extract, we see a linear downward trend with higher dosages associated with lower concentrations. If we look carefully, we can see that at 25 milligrams per kilogram of the isolate and between 4.5 and 9 milligrams per kilogram of the extract, these two levels are associated with roughly the same serum concentration of TNF-alpha. Now we are transitioning to a different experiment in this same study, one that compared CBD with other medications that might be used in a setting of acute inflammation. In this graph, we are looking at a comparison of the two versions of CBD with each other, and then with aspirin and tramadol, in terms of their impact on paw swelling. The whole plant extract is on the very far right of the graph. It is referred to as CL.202, which is clone 202. In each of the next three graphs, the two CBD treatments are not compared to each other. They are only compared to the control condition, which was no treatment. As a result, we can only infer differences between them by examining the height of the bars in the bar charts. In the previous graph, we looked at oral administration. I didn't show the intraperitoneal injection graphs because I thought that oral administration was more clinically relevant. If you want to look at those graphs, they are available in the paper in figure 2. In this graph, we are mostly looking at the intraperitoneal injection as the method of administration, except for aspirin, which was administered orally. The dosing is as follows. For aspirin, it's 50 milligrams per kilogram, delivered orally. For tramadol, it's 5 milligrams per kilogram. For the isolated CBD, it's 5 milligrams per kilogram. And then for the clone 202 extract, it's 50 milligrams per kilogram of extract, which equals 9 milligrams per kilogram of CBD and 0.6 milligrams per kilogram of THC. Now, just for context, I weigh 170 pounds, which is roughly 78 kilograms. 50 milligrams per kilogram of aspirin, for me, would be almost 4 grams of aspirin, which is a very high dose of aspirin. Looking at the graph, we can see that the onset of maximum effect seems to be closer to 24 hours than 6 hours. And this is consistent with the other paw swelling graphs we saw earlier. The effect on swelling seems to take more time than the effect on anti-nociception. Interestingly, 5 milligrams per kilogram of isolated CBD and 9 milligrams per kilogram of CBD in the extract seem to have a very similar impact on paw swelling. These bars look almost identical at both 6 and 24 hours. Both are statistically significantly different or more effective at reducing paw swelling when compared to the control. Other than the two CBD treatments, only aspirin and only at 6 hours demonstrated a statistically significant reduction in paw swelling. Tramadol had no effect. This is the graph for paw withdrawal. Here, all treatments at all time points resulted in a statistically significant increase in the force required to induce a paw withdrawal. When looking at the two CBD treatments on the right, it appears that the whole plant extract produced a greater effect than the isolate at almost twice the dose. Both aspirin and tramadol resulted in greater analgesia than either CBD treatment at every time point, with 6 hours representing the maximum effect. And finally, we are looking at the impact on this graph of the various treatments on serum TNF-alpha concentrations. Again, the two CBD treatments are on the right side of the graph. And again, it appears that the CBD treatments were statistically significantly superior to control in terms of lowering TNF-alpha levels. They also appear to be superior to aspirin and tramadol just by comparing the bar graphs. Tramadol was not statistically significantly different than control. Aspirin was. Notice that the isolated CBD at 5 milligrams per kilogram led to a greater reduction in TNF-alpha concentration than approximately double the dose of the whole plant extract. This contradicts many of the other findings we've seen that show a lower dose of the extract leading to the same or a greater effect as a higher dose of the isolate. Let's quickly review the basic findings of this study. First, CBD appears to have a beneficial effect on swelling, pain, and inflammatory markers in an experimental model of acute pain and inflammation in mice. Secondly, CBD compares favorably with tramadol and aspirin in most outcomes and is superior to those drugs in terms of lowering TNF-alpha levels and reducing swelling. There appears to be a different dose-response curve for isolated CBD as compared to CBD in a whole plant extract. The difference in these curves is more evident for anti-nociception and serum TNF-alpha concentration than it is for swelling, and it appears as if with a whole plant extract, more may be better. The investigators used a very high dose range of CBD in both the CBD treatment groups. It appears that a lower dose of CBD in a whole plant extract may actually result in better outcomes. This study has several limitations. First, it is a preclinical study, and extrapolating these effects to human beings is difficult because men are not mice and mice are not men. The sample size is small, the outcome measures are indirect. Also, it's a little concerning that the lead author on the paper has been a longtime consultant for the company that provided the whole plant extract, Tikkun Olam, a cannabis producer in Israel. It's a potential conflict of interest. Let's return now to our clinical questions. First, does oral administration of CBD reduce pain and inflammation? Yes, particularly with anti-nociception and serum TNF-alpha concentrations. The impact on swelling was less impressive. 2, does CBD in a whole plant extract have greater therapeutic efficacy than isolated CBD? The answer to that question appears to be yes also. Whether this is due to the THC or the entourage effect is not known. And then 3, is a lower dose of CBD in a whole plant extract comparable to a higher dose of an isolate? The answer to that also appears to be yes, generally speaking. Thanks for your time and attention. Please reach out to me if you have any questions.